Pain is one of the top reasons Americans miss work or visit the doctor, but millions still avoid getting help. Why? It's a question I think about a lot, both as a physician and just as a person who sees friends and family toughing it out. We live in an age with incredible medical advancements, yet so many of us are walking around with backaches, neck stiffness, and chronic discomfort just pushing through it. We tell ourselves it's normal, or that we're too busy, or that it's not bad. But that nagging pain is your body's alarm system, and ignoring it can have serious consequences down the line. It's a complicated issue, blending psychology, finances, and our healthcare system itself. So I wanted to dive deep into this. What are the real reasons holding us back from feeling our best? Today we're counting down the top 10 excuses Americans give for not seeking help for pain, plus what you can do instead. We're going to break down each one, look at the data behind it, and talk about actionable steps you can take to overcome these barriers. Because living with pain shouldn't be your default setting. I want to empower you with information so you can make the best decisions for your health. This isn't just about feeling better, it's about getting your life back. And listen, I know there's a lot of misinformation out there, so I've made sure to do my homework for you. We're going to look at studies, reports, and real statistics to understand this problem. All sources are cited, so you know the facts are real. I'll link everything down in the description so you can check them out for yourself. All right, are you ready? Let's get into it and start this important conversation. Kicking off our countdown at number 10 is an excuse that sounds incredibly responsible on the surface. I'll just stretch it out, or I just need to rest for a few days. And don't get me wrong, for a minor muscle pull after a workout, rest and gentle stretching can be exactly what the doctor ordered. The problem arises when this becomes the default, long-term strategy for a persistent or recurring issue. Many people create their own self-care routines, piecing together stretches from YouTube videos or advice from a friend, and they stick with it, hoping it will eventually solve the problem. They believe they are actively managing their health, so they don't feel the need to seek a professional diagnosis. This approach, while well-intentioned, can be a major roadblock to getting proper care. A 2015 study in the Journal of Orthopedic and Sports Physical Therapy highlights that while self-management is a key part of recovery, it's most effective when guided by a professional diagnosis. Without that initial assessment, you're essentially guessing. That tight hamstring could actually be sciatic nerve irritation, and the stiff neck might be related to a disc issue that requires specific, targeted interventions, not just any generic stretch. Delaying a proper diagnosis for what seems like a simple muscular issue can allow more serious structural or neurological conditions to progress unchecked, making them much harder to treat later on. Coming in at number 9 is a huge one. I don't even know where to start. The healthcare landscape can be incredibly confusing. If your back hurts, do you go to your primary care doctor, a chiropractor, a physical therapist, an orthopedist? The sheer number of options can be overwhelming, leading to what we call analysis paralysis. You spend so much time trying to figure out the perfect first step that you end up taking no step at all. This confusion is a legitimate barrier to care, and it's something the healthcare system needs to get better at addressing. The 2016 National Pain Strategy Report from the Department of Health and Human Services specifically identified this as a major problem. It pointed out a widespread lack of clear guidance and public education about the different types of pain care and which providers are best suited for certain conditions. People are left to navigate a complex and often fragmented system on their own. This uncertainty isn't just about finding the right type of doctor, it's also about trust. With so many conflicting opinions online and in the media, it's hard to know who to believe. This lack of a clear, trusted pathway keeps people stuck in a cycle of pain and inaction. At number 8, we have an excuse rooted deep in our culture and psychology. I don't want to seem weak or be a complainer. This is the tough it out mentality. There's a powerful stigma around admitting you're in pain, as if it's a character flaw rather than a physiological signal. This pressure can be internal, coming from our own beliefs about self-reliance, or external, from our workplaces, families, or social circles. We worry that speaking up about our pain will make us seem less capable, less resilient, or just burdensome to those around us. This is particularly prevalent among men and high-performing individuals like athletes. A 2018 Gallup poll showed that men are significantly less likely than women to see a doctor, and this extends to reporting pain. Similarly, a 2013 study in the British Journal of Sports Medicine found that athletes often hide or downplay injuries to avoid being seen as weak or losing their spot on the team. This stoicism is dangerous. It forces people to suffer in silence and normalizes a level of discomfort that is absolutely not normal. Pain is a message, not a measure of your strength. Ignoring it doesn't make you tough, it just makes you more likely to face a bigger health problem later. Excuse number 7 is born from frustration and disappointment. I already tried getting help and it didn't work. This is a tough one because honestly, these feelings are completely valid. Maybe you went to physical therapy for 6 weeks and didn't feel much better. Maybe you saw a chiropractor and the adjustments just didn't hold. Maybe you got injections that only gave you temporary relief, or even had a surgery that failed to resolve your pain. When you've invested time, money, and hope into a treatment that fails, it's really easy to become discouraged and, kind of cynical about your options. This experience can lead to a sense of hopelessness, making you believe that nothing will work. A major 2017 study in the Annals of Internal Medicine on low back pain treatments found that while things like physical therapy, chiropractic care, and acupuncture were effective for many, they weren't a magic bullet for everyone. Not every approach works for every person or every condition. The key here is not to give up on seeking care altogether, but to recognize that your first attempt might not be the right fit. It doesn't mean your condition is untreatable. It often just means you haven't found the right diagnosis or the right combination of therapies for your specific problem yet. This next one, at number 6, is a serious indictment of our healthcare system. I'm afraid my doctor won't take my pain seriously. Thousands of patients, unfortunately, have had the experience of trying to explain their symptoms only to feel dismissed, rushed, or outright disbelieved by a healthcare provider. They're told it's all in your head, that they're just stressed, or that their pain levels don't match what the scan shows. This experience is not only invalidating, but it can also be incredibly damaging, eroding trust in the medical profession as a whole. And the data shows this is not just an occasional anecdote, it's a systemic problem. Research has repeatedly shown that women and racial minorities are disproportionately affected. A 2011 study in the Pain Medicine Journal found significant racial and ethnic disparities in pain management, and a 2019 NIH publication highlighted that women's pain is more likely to be dismissed or undertreated compared to men's. When you feel like you have to fight to be believed, it's exhausting. It makes you not want to even try. Finding a provider who listens, validates your experience, and partners with you in your care is absolutely critical. Halfway through our list, at number 5, is an excuse driven by a very powerful emotion, fear. I'm afraid treatment will make things worse. This fear can take many forms. It might be the fear of a scary diagnosis, like being told you have a degenerative disease or need major surgery. It could be the fear that the treatment itself will be painful, that physical therapy will hurt, or that a chiropractic adjustment will cause more damage. This anxiety can be paralyzing, creating a fear avoidance cycle where the fear of pain actually leads to more disability than the physical condition itself. This isn't just a feeling. It's a well-documented psychological phenomenon in pain management. A 2017 paper in the Journal of Pain Research explored how fear avoidance beliefs are a major predictor of chronic pain and disability. When you're afraid to move, you become deconditioned. Your muscles get weaker, your joints get stiffer, and your world starts to shrink as you avoid activities you think might trigger your pain. This avoidance, meant to protect you, actually ends up trapping you in a cycle of worsening pain and function. Overcoming this requires not just treating the physical issue, but also addressing the psychological component of fear and anxiety with a trusted provider. Excuse number 4 is one of the most common and honestly tempting forms of self-reassurance. It'll probably just go away on its own. This is what we call the wait-and-see approach, and let's be real, we've all done it. You wake up with a crick in your neck or maybe a twinge in your lower back and you think, I'll give it a few days. Sometimes, for very minor acute strains, you might actually be right. But here's the thing. This becomes a really dangerous gamble when a few days quietly turns into a few weeks, or even a few months, or, wow, sometimes even years. People, especially younger adults, often operate with this sense of invincibility, believing their bodies will just bounce back from anything. In fact, a 2020 study published in JAMA found that this belief is a major reason for delaying care, especially for musculoskeletal issues like back and neck pain. The problem is, what starts as a minor off-and-on pain can slowly evolve into a chronic dysfunctional pattern if the underlying cause isn't actually addressed. Your body is incredibly good at compensating. If one area is injured, other muscles and joints will work overtime to pick up the slack. This compensation can mask the root problem for a while, but eventually, those overworked areas start to break down too. That's when a simple, treatable issue transforms into a complex, chronic condition that's much harder to resolve. Hope is not a strategy. Early intervention is key. Excuse number 3, I'll just take something for it. So, here we are in the top 3, and honestly, this quick fix mentality is everywhere. In our society, we're just so conditioned to look for a pill to solve our problems, and pain is definitely no exception. It's, incredibly easy to just reach for over-the-counter painkillers like ibuprofen or acetaminophen. And when those don't work, well, some folks might even turn to stronger prescription medications, including opioids. The thing is, this whole approach focuses entirely on masking the symptom, the pain, instead of actually investigating and treating the root cause of the problem. This is a huge issue, and it was really highlighted by the NIH's Federal Pain Research Strategy back in 2015. They pointed out just how much we, as a society, over-rely on pharmacological solutions for both acute and chronic pain. And yes, while these medications can be useful for short-term relief, using them as a long-term strategy is kind of like putting a piece of tape over your car's flashing check engine light. You've silenced the alarm, but the engine is still breaking down. This can easily lead to a dangerous cycle of dependency, potential side effects from long-term medication use, and, most importantly, it allows the underlying mechanical, structural, or neurological issue to just get worse because it's not actually being addressed. Excuse number 2, I don't have time. This is one that I think every single one of us can relate to, right? Life is just busy. We're juggling demanding work schedules, family obligations, childcare, social commitments, and just honestly trying to keep our heads above water. The idea of adding one more thing to that list, like researching a doctor, scheduling an appointment, driving there, waiting in the office, and then doing follow-up visits can feel completely overwhelming. It just feels easier to push the pain to the bottom of the to-do list and hope we'll get to it when things calm down. But of course, things rarely calm down. A 2020 Harris poll actually confirmed that time is a massive barrier to seeking healthcare. People cited inflexible work hours, lack of paid time off, and responsibilities as caregivers as major reasons they delay or avoid care. And long wait times for appointments just add to this frustration. The irony here is that ignoring pain often costs you more time in the long run. Unmanaged pain leads to decreased productivity, sick days, and can eventually become so debilitating that it forces you to take even more time away from the very work and family obligations you were trying to prioritize. Investing just a few hours in your health now can save you weeks or even months of lost time later. And here we are, excuse number 1, it's too expensive. Unfortunately, this is the reality for millions of people. The cost of healthcare, even for those with insurance, can be just a staggering burden. High deductibles, co-pays, and co-insurance mean that even a simple diagnostic visit can result in a surprise bill for hundreds of dollars. And for the millions who are uninsured or underinsured, the fear of that cost is enough to make them decide that living with pain is their only viable option. It's honestly a heartbreaking choice to have to make. The CDC's National Health Interview Survey data from 2019 is crystal clear on this. Cost is the single biggest barrier to accessing care. People reported delaying or foregoing needed medical care, including for significant pain, because they were worried about their ability to pay for it. This financial barrier prevents people from getting early, conservative care, like chiropractic or physical therapy, which can often be the most effective and least expensive route. Instead, they wait until the pain is just unbearable, and often end up in an emergency room or needing more invasive and far more expensive procedures down the road. It's a system that is, in many ways, penny-wise and pound-foolish. So there you have it, the top 10 excuses that keep us trapped in a cycle of pain. We've talked about cost, time, fear, frustration, and stigma. It's clear that these aren't just simple excuses, they're actually significant, real-world barriers. but recognizing them is the first step to overcoming them. Delaying care for pain can lead to chronic conditions, increased disability, or even reliance on medications. That minor backache you're ignoring could turn into a debilitating disc issue. That wait-and-see approach could end up costing you your mobility, your productivity, and your quality of life. Don't let these excuses hold you back from living the life you deserve. I know it can feel daunting, but you don't have to navigate this alone. The most important step you can take is to find a healthcare partner who listens, understands these barriers, and is committed to finding the root cause of your pain. If you're struggling with pain, Bethesda Spine and Posture can help you find real solutions. Their team specializes in diagnosis and personalized treatment plans that get to the heart of the problem, helping you move beyond just managing symptoms. Book your consultation today and take the first step toward feeling better. It's honestly an investment in your long-term health and happiness. Thank you so much for joining me for this important discussion. I really hope this has been informative and empowering for you. Your health is your most valuable asset, so please take care of it. All sources are linked below if you want to do some more reading. Thanks for watching.